Hello, my name is Catherine Kwame, and this is my presentation about laughter therapy. Hello, and thank you for joining me for the first laughter therapy session. Just imagine that this group of people on the screen are your laughter buddies. Are you ready to laugh with me? Okay, everybody stand up, nice, straight, and tall, and I want you to put your hands on your stomach and laugh. Ha, 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 ha. Ho, 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 ho. Very good. Okay, take in a deep breath, and then when you exhale, I want you to laugh. Inhale. Again, inhale. Very good. Okay, so this would be an example of what you might experience at the beginning of a laughter therapy session. The idea is to make yourself laugh using these exercises in order to get the benefits of laughter. And I will give you more information through the rest of my presentation. Thanks so much. Well, that was a hoot. Thanks so much. Laughter therapy, aka laughter yoga or laughter exercise, is any intervention that promotes health and well-being by stimulating laughter, playfulness, and joy. This is typically a group therapy session because, as I'm sure we all have experienced, laughter is contagious, and it uses unconditional laughter, breathing exercises, eye contact, movement, stretching to make yourself laugh in this group setting. There very much is a fake it till you make it mentality. Many benefits that we'll talk about later have been shown from laughter, but your body doesn't know if you're laughing because you think something is hilarious or if you're laughing because you're forcing yourself to laugh. You still get the benefits. And so the idea is that when you use the exercises to make yourself laugh, it may eventually become real, but even if it doesn't matter. You still get the benefits. There are many uses for laughter therapy, lots of clinical trials and many research studies. Here are some that I found that were very interesting. They've been shown to be beneficial for cancer treatment and chemotherapy. People on dialysis, people with irritable bowel syndrome have used it to help decrease the amount of anti-anxiety medications that they've had to take. It's used for depression, anxiety, to improve sleep. It's been used for decreasing menopause symptoms, stress reduction, socialization, and many more uses. Now, the benefits. Well, it's easy, it's affordable, there is no high-tech equipment that you need to purchase, and it's non-invasive. It has been shown that laughter will improve quality of life, mood, the secretion of endorphins and serotonin. It improves circulation, especially when you get all that extra movement in. It improves quality of sleep, immune system function, self-confidence, and socialization, which can be especially effective for people who tend to be very isolated. Laughter also will reduce stress, depression, pain, and our stress hormones, our cortisol levels. So there are a lot of benefits that have been scientifically proven from laughter. Now, some limitations. This is best as a shared experience, which during COVID can be a little tricky to get people together and feel comfortable laughing and being in a close proximity to each other. And, the other big limitation is that it really can push people out of their comfort zones. People need to buy into the therapy and actively participate in order to get the most value from it. If you go to a laughter therapy session and you just sit in the corner, well, you're not going to get a whole lot out of it, but it can take a lot to let your hair down and to let go of inhibition and jump into something and say, I'm going to do this no matter how ridiculous I might feel. That can be really hard for some people to kind of step over that boundary. Precautions, well, there's no contraindications for laughing. Um, it's a universal thing that people do. It can be adapted to all levels of physical mobility and flexibility. My one thing that I would say is that it's important to remember the difference between humor and laughter. Humor is very individual. You know, give me a good pratfall or a pie in the face and I will be laughing, but there might be jokes that I just don't find funny or don't find laugh worthy, and it's different for every single person. Now, laughter, the benefits of laughter is universal. And so we're not doing a comedy club here. We're using the act of laughing to help induce all of these benefits. And then I just say people should be prepared to have improved mood, quality of life, fun, and social connections. I wanted to just give you a small sample laughter yoga session up here. You can Google this and find all sorts of YouTube videos of different laughter yoga sessions. They usually start with a warm-up exercise like I showed you earlier, smiling, breathing, laughing, then do sort of the core laughter exercises. There's lots of movement, clapping, arm movement, maybe moving your feet as well. Deep breathing exercises, and the great thing about laughter is that it really is contagious. And so it can start off as being forced and become spontaneous just through being in a group of people laughing. And then a session will usually close with an affirmation and maybe some meditation exercises as well. Other ways to incorporate laughter into client care. Again, appropriate humor. There are times when humor is inappropriate. You should never be poking fun at people, and just be careful about the words that you're using. You can bond over absurdity of a situation instead of getting frustrated. Smiling is always an important part of care. And then just to remember that this is used in conjunction with other treatments. A patient with cancer is not getting this in place of chemotherapy, but they are getting it to help relieve the symptoms of chemotherapy and to help improve their quality of life. So that's just important to remember. Now, education you want to provide your clients. Tell them the benefits of laughter therapy, and then just let them know that they have to be willing to be silly, to approach sessions with openness and a desire to laugh, and that this is best done in a group. It can be done alone, but they just need to be comfortable in a group setting as well. In conclusion, laughter therapy is a non-invasive, inexpensive, beneficial alternative therapy for a wide range of conditions. It can be used for all ages and genders. Laughter can bring people together and create community. And it doesn't have to be real to be effective. And often during therapy, the laughter will become real. The benefits just are huge and there's no risk. So why not try it? My discussion questions are: what are some barriers nurses might face when trying to implement a laughter therapy group on their unit? Second, have you seen laughter and/or humor being utilized in the clinical setting? Did it seem effective for improving quality of life? Why or why not? And last, are you ready to infuse joy and laughter into your nursing practice? These are my references. Thank you so much.